The daily number of new COVID cases stalls as Massachusetts races to vaccinate more residents. And here to answer your questions is Dr. Daniel Kiriskis, Chief of Infectious Diseases at Brigham and Women's Hospital. Good to see you.
Good to see you, Emily.
So we're not the only state stuck on this plateau. Today, the CDC director said that she's worried about the latest national data showing this apparent stall in 7-day averages for new cases, hospitalizations, and deaths. What do you think is happening here?
Well, I think very clearly we're seeing ongoing transmission among people who are not masking and are not socially distancing. I think the increasing travel and particularly spring break may be contributing. And it may be that there's a contribution of the increased infectiousness of some of the variants that are now circulating.
So we compare that with vaccinations. The CDC saying the pace of vaccinations in the U.S. has doubled in less than 2 months. How does Massachusetts compare to that, number one? And do you think we're moving fast enough to stop another surge?
Well, we're seeing increasing numbers of people being vaccinated in the state week over week. So the pace of vaccination is definitely accelerating. But we're not going to be able to rely on vaccination to stop a surge in the next couple of months. We really won't see vaccines have that kind of effect until 70 or 80% of the population is vaccinated.
And that's why those precautions are still so important?
Exactly.
Okay, so this is interesting. I want to ask you about this. We heard from a viewer on the Cape who said that he received a second dose of his Pfizer vaccine on February 15th. A month later, he says he got sick and tested positive for COVID-19. Is that unusual? And do we have any information yet about how well the vaccines prevent not just severe symptoms, but infections?
We have only preliminary data from one of the studies about prevention of infectiousness, which seems to be the case. We expect more data next month. But we have to remember that no vaccine is 100% effective. We're always going to see some breakthrough infections occurring. And that's why it's still so important for people to be wearing masks, at least until we see the numbers go way, way down across the nation.
Yeah, I think we can't reiterate that point enough. Finally, tonight, while we have you, I want to talk about COVID treatments. This new study out today confirming that remdesivir shortens the duration of illness in hospitalized patients. What's your experience with this drug? Do you agree that it works?
Yeah, my experience has been really pretty much in line with what was published today. That confirms the results of the clinical trials that were done. We know that remdesivir helps to shorten the duration of hospitalization when given to people with moderate or severe disease. Unfortunately, it seems to have less of an impact in people who are the most critically ill. But still, it's a very important drug to have in our armamentarium to help fight this disease.
Yeah, all good insights. All right, Dr. Kiriskis, thank you for your time. As always, we appreciate it.
You're very welcome.